The payer role is primarily to implement the payment model. We don't require any sort of quality score for these before we'll cover the encounter. We'll pay for it if you just send us the code, we'll pay for it, even if you did a very bad job of it. We often don't know what kind of quality is done because the details of the conversation and the documentation are in the clinical record. We don't see the clinical record. All we get is the claim. We certainly have at least in our company at Regents and Cambia, we certainly have an interest in making sure that these are high quality conversations. And I believe we have a role in helping to educate the provider community, the community themselves, for their own interests in professionalism, certainly have an interest in that. Some medical groups are much more engaged in that and do internal training, you can't call it role playing because no one will show up, but they'll do skills practice and people will show up for that. But providers often, the frontline providers are eager, maybe a little overselling it, but they're willing, at least, if not eager, to learn how to do a better job of these conversations. The main reason we hear back from people, why aren't you doing this? Well, I'm just a little uncomfortable with that. I'm worried I won't do it well. So there's a lot of interest in the provider community to get better, and it's really communication skills. It's not so much the technical aspects of what you need to ask, it's how do you ask it? How do you sensitively and appropriately do this without offending people, as saying, without making them think you're, shuffling them off to some terrible end or something. But it can be done warmly and supportively and with a lot of empathy, and most providers are willing to learn that, if not eager, some eager. So what I would say engaged medical groups or good medical groups are investing in that and have programs set up, often web-based for some of the content issues, but then there has to be some experiential component of it if you're really going to drive change. I've done that in previous medical groups that I was a part of, where we took all the primary care docs out of the office for half a day to do skills practice, and all the nursing home rounding team, all the hospitalists, most of the specialists. The surgeons didn't really want to come, but we tried to cajole them along too, and get them together in small groups to talk about the importance of this, get buy-in, get their commitment, and then actually work on scripting and practicing so they're more comfortable with actually having said the words to one another. And that helped to drive change and make them more comfortable. And we like to think helped improve the quality of what they document and what patients take with them.